Eddie Burkhalter, Alabama political reporter. The percent of tests that are positive remain high in Alabama, and we continue to see record highs in hospitalizations and new cases. Yet Governor Kay Ivey hasn't instituted any new restrictions. In your opinion, what would you like to see the governors in states with increasing coronavirus cases do?
Well, that's a good question, and we have some pretty standard answers for that. When you look at what we can do that we know works, it's the use of masks and physical distance and avoiding crowds. And I think to the extent in which this would be acceptable in the community, I am strongly in favor of mandating things. I don't like to be, authoritarian from the federal government, but at the local level, if governors and others essentially mandate the use of masks when you have an outbreak, I think that would be very important. Also, bars. We know that bars, particularly bars that are indoor, some bars are outdoor, but most of them are indoor. When you are indoor in a bar, in the crowded situation in a bar, that's a perfect setup for the spread of infection. So simple things, fundamental things like masking, distancing, washing hands, closing bars. If you do that, I think it'll be a giant step towards interfering with the spread in your community.
Let me follow up on something, Dr. Fauci, that I just saw recently in the last couple of days that I'd like for you to maybe comment on. There is some discussion from the WHO, the World Health Organization, that the virus, these particles may linger in the air a little bit longer than first thought. I don't think that science is completely up to date on that right now, but have you seen that, and could you comment a little bit about that?
Yes. It's referred to as aerosolized, or sometimes referred to as airborne, which means as opposed to a respiratory droplet, if I cough or sneeze or even speak, you can get thin droplets that go out for a certain number of feet, usually 3 or 4 feet, and then they go to the ground. And that's the reason why we talk about the 6-foot distance. When you talk about aerosol or airborne, there have been demonstrations of viruses that can actually stay in the air for much longer and hence get caught up in the circulation system of a given room. There isn't a lot of definitive evidence about what the impact of the aerosolization is on COVID expression. However, we have some good examples back with SARS, which is a similar virus, where there were clear-cut examples of spread by aerosol. So although we don't think it's a major issue of spread, it's something that we can't completely rule out, which is a reason, Senator, why we insist that people wear masks, because that will protect you against that.